Hi, I'm Lauren Haring, Director of Nursing and Practice Manager at the Genetics and IVF Institute. I'm going to take you through what to expect upon starting treatment here at GIVF. At your first visit at Genetics and IVF, you would check in with the receptionist at the front desk to meet with your physician. When the physician has reviewed your case, they will bring you back to meet with the doctor for roughly about an hour for the initial appointment. While you're meeting with the physician, they're going to review your medical history and any other relevant information that's going to help them determine what's the most appropriate diagnostic testing for the female partner and the male partner if present. Then they will help discuss what that testing is going to entail so that we can figure out what's the most appropriate treatment for you. After meeting with a physician, each patient will have a primary nurse that's going to meet with them and then review all of the testing the doctor has ordered to make sure everything is clear, and they will also provide any lab orders if appropriate in that situation. Once that part is complete, we do have a financial counselor available just so that every patient understands their coverage options and we can make it as smooth of a process as possible. Overall, the appointment will probably last initially about an hour and a half to meet with all of the staff that day. The testing order for each patient is going to be customized based on their medical history as well as their age. For the female patient, it typically begins with lab work that's done around day 3 of the cycle to evaluate ovarian reserve. Following that, they would have either an HYS, which is a hysterosonogram to evaluate the uterine cavity and make sure that it's normal. Otherwise, they would have an HSG, which is a hysterosalpingogram, and that's an X-ray test to evaluate if the fallopian tubes are open and also to check that the uterine cavity does not have anything that would interfere with the pregnancy. If there is a male partner present, then they would undergo a routine semen analysis as well as some lab work. After the testing has been completed, each patient will return to the office to meet with their primary physician again for a follow-up appointment to go through in detail all of those test results and what form of treatment is going to yield the best outcome for them. Their primary nurse will review any appropriate consent forms for their treatment and assist them with all aspects of their care. Treatment options are customized for each individual patient or couple coming into our office. It can begin with something as simple as timed coitus on their own at home without any medication or possibly with the addition of clomiphene citrate. Then we can move on to something called IUI, that's intrauterine insemination. This can also be done without any medication or possibly with the use of clomiphene citrate, letrozole, or even something called follicle-stimulating hormone or gonadotropins. Some patients will move directly into IVF, which is in vitro fertilization, or down the line into donor egg IVF. This is sometimes done in conjunction with PGD, which is pre-implantation genetic diagnosis, and your physician would discuss if that's something that is appropriate in your case. In some instances, though, there are women who will come into our office also to explore the possibility of egg freezing or personal egg banking. Typically, an IVF cycle takes 2 months to complete, with the first month leading into the IVF cycle as a month of birth control pills. Using the birth control pills allows for a better response to the medications overall, if appropriate in each patient's scenario. The IVF cycle involves 8 to 12 nights of stimulation or fertility medication taken by injections. During that 8 to 12 day time span, patients need to come in early in the morning for monitoring visits about 5 or 6 times, which involves both blood tests and ultrasounds. Each day, they are contacted with instructions once the results have been reviewed by the physicians. Based on the results of the monitoring, the physician will determine when it's the most appropriate time to plan for the egg retrieval process. They will advise the patient to take a final trigger injection to get everything ready for the retrieval to happen roughly about 2 days later. From that point, the embryo transfer is typically scheduled between 3 to 6 days later if a fresh transfer is taking place. In some patients' cases, the physician will decide ahead of time and discuss with the patient if the embryos will need to be frozen and then transferred in a subsequent frozen embryo transfer cycle. If a fresh transfer is performed, then each patient would return to the office at the given time frame to have their blood tested to find out the outcome of the cycle, and then from there we would review the next steps. Typically, IVF is not a painful process. Usually the symptoms associated with it are no more than what you can take care of on your own at home with extra strength Tylenol. There is often some bloating or fullness that occurs in the lower abdominal area, but we do provide some tips to help avoid that, or if it does happen, some ways to help it go away faster. It is not very common for most patients to feel like they're on an emotional roller coaster through the process due to the medications. This is overall an emotional process just because of everything that has been invested financially, physically, emotionally. You've worked very hard to get to this point. We do want to make sure you know that the nursing staff is here as a resource for you to use at any time. We are here to support you, but also having friends or family members or even a local support group to talk with when you're feeling like you need just that little extra ear of support can make a huge difference in your overall feeling at the end of this. At Genetics and IVF, we are with our patients every step of the way, answering their questions, ensuring this is a smooth process, and basically just taking the mystery out of everything we have to offer. We look forward to seeing you to discuss all of the options that GIVF has available for you.